Madam Chair. Thank you for the panel. This has been an excellent presentation. The first cases of COVID were detected in the United States a year ago. Early in the pandemic, Congress acted in 4 bipartisan bills, which is important for the unity that we need in America today. Secretary Leavitt, in testimony, noted that we'll get better at this. We're a year in, actually more than a year in, because we need to be working 24 hours a day. And so that year is really 3 years of work, hopefully. Mr. Burrell noted that we are short on everything. And Dr. Moreta said that today we are going to need a full court press. We needed a full court press from the beginning. Over the summer in one of the hearings, I asked Dr. Fauci, would we be ready in the fall and early winter? He said, I hope so. Then I asked him again in another meeting, we'll be ready in the fall or winter. In fact, he said that as we were getting into the fall. He said again, I hope so. It is obvious from the testimony today that we are nowhere where we need to be in relationship to where we should be. From April until the end of December, Congress was unable to come together to provide additional support to build out a robust national testing contact tracing system. And in fact, almost every other discussion we've had today. Despite claims to the contrary, because it became overly reliant, the prior administration, on states to implement their own testing strategies. That's clear that they're needed, but it has to be a coordinated process. Test kits, everything else, we're still in short supply. I'm going to try to cut some of this out because it's been talked about. But the national strategy has been talked about time and time and time again, and not just today, but the need for it. And here we are sitting talking about it still a year later. Time is of the most importance. In my district, I have people in my district similar to others, mostly rural areas, not being able to get tested. And when they get the first shot, they can't get to the second shot. The computer systems are in a situation where they are mostly, if you're dealing with somebody from the Hispanic community or from some of the tribal communities, which I have a lot of, they have problem even having a computer, and it's required in many areas. And I'm glad to see that the president has called for $50 billion to build out a national testing program, which we've talked about so many times over the course of this last year. We have to ask so much from our frontline workers, and we're still where I can remember when this first started. They still don't have where we need to be. Dr. Burrell, I appreciate the honesty and self-reflection in your testimony. One of your recommendations called for the CDC to immediately expand its genomic surveillance system. Can you explain upon how, in conjunction with President Biden's plan to spend $50 billion in testing, this will help quickly identify new variants of infectious diseases like COVID-19, and how that will impact public health recommendations offered by scientists at the FDA or the CDC, and how it will help in the future?
Thank you. I'll elaborate in writing for you afterwards, but briefly, the fact is that early on, we knew this is an RNA viruses. They mutate, they always mutate, and we didn't really have a system to be able to begin to sequence, to receive viral samples from patients to locals to state labs to the CDC or another sequencing lab, sequence them, and then do a data analysis. So we can really track the evolution of the virus, detect the emergence of variants, and understand where they were spreading. So it took, the alerts in the UK and South Africa to get us to then begin to scale up our systems, but it's still very inadequate for what the need is.
Doctor, I have to interrupt you because my time's almost up, and I'd like to ask you, how long has this system been needed? And how long have the professionals been asking for it?
The need precedes this pandemic.
Thank you very much, and I yield. Thank you, Madam Chair.